Welcome back to our podcast. This is Skin Deep with your host, moi, Lena. And I have a special guest today. My favorite guest, actually, is
She says that to all the guys.
Shut up. No, I actually don't. It's my favorite hot, sexy doctor, Doctor Esteva, aka Soraya.
Mm-hmm.
Welcome.
Thank you. Thanks for having me. It's the first time I've ever done this.
I know,
It's exciting.
It's fun. And I know it's going to be fun with you because, you don't have a filter and we love that here.
Who, me? Yeah, it's a blessing and a curse. But I think this will be great so patients can get a chance to kind of hear. And this is a lot like how the consults go. Pretty down to earth. We can kind of just shoot the shit. Hopefully, can I cuss on this?
Yeah.
Okay, good.
Yeah.
There you go. Now you really know me. Now we're friends. But anyways, like try and keep it very, informal but professional-ish.
Well, why don't you formally introduce yourself? I know everybody knows of you, but since, you're such a busy boss woman, we don't get to film enough with you. I think we should be able to film you more.
Working on that. I'm giving love to.
Yeah, exactly. So she is our hormone therapy and weight loss doctor. She's been doing it about 10 years now. Tell us more about that and your background.
Yeah. So actually, I'm traditionally trained as an OBGYN, and it's a very similar transition. And I just noticed just in my traditional training, just the struggle that women go through from adolescence to childbearing ages, postpartum issues, and postmenopausal issues, just this trend of overall happiness, well-being, and then how metabolically you change throughout those phases in your life, and how weight hormones plays an integral part in that. And as people change, they really do need the knowledge and the tools to be able to kind of help them to feel better about that self. And part of that is, with weight loss. Part of that is with recognizing that there are choices hormonally that you could do at different points in your life, being perimenopausal and menopausal. So it was a natural reach to actually come to Silhouette and offer those services. When we first envisioned this practice with Dr. Wen and Dr. Parsa, who were mostly aesthetics based, they were excited to have me as the surgeon, first of all, because I'm an OBGYN. But also I said, weight loss is a natural thing that we're going to do. And we did that from the beginning. And the thoughts that we'd all kind of actually jump over. So I would do aesthetics and they would in turn do what I did. But my side of the business just really did take off, where I never really had even the chance to go over to the aesthetics. I just partake in them, which I love. And thank God, I feel like,
it's kind of like it goes hand in hand, right? Like you can't always look good if you don't feel good internally, or if you don't view yourself, or you're not at your ideal weight or how you want to be, or if you're not on the right journey in regards to your weight goals and things like that. That plays a big role, because you can do all these treatments and all these fillers and all these injectables, but I think what Dr. Esteva does that's really important is she really helps you from inside. And feeling good inside obviously resonates on the outside.
I really like what you said. If you don't feel good, you don't look. I think that is the thing. And I was talking to my 14-year-old son, who's just a big beefcake. He's like 6'2", he's 180, he's a freshman football player, and he has a teacher who's a little bit overweight, and he's super judgy because he's just like a little, adolescent boy.
Yeah.
And I had to break it down. I said, listen, when you have weight, number one, you have weight. And I said, what do you know in that person's life that could be triggering that? It is a lot deeper it could be hormone based. It could be emotionally based. Yeah. What is it?
And you can have underlying medical conditions.
You can have underlying abuse. You can have trauma. It is just, it's so easy. And of course, his frontal lobe is still developing. So of course I love him. And I'm just using this as an example. But this is what society, how we see this. And we also judge ourselves. So yes, I agree. It's like, what is the underlying cause? I can get anyone to kind of usually lose the weight. I think what ends up happening and morphing throughout the meetings that people have over the years, and I've been seeing some clients for almost the entire 10 years, because weight is a chronic issue. And until we see weight as a chronic disease, much like hypertension, much like diabetes, where it's not a failure if you come back regaining the weight, it's because it's a marathon. Yeah. And that's going to ebb and flow, but really dealing and being able to check in with people and checking in on their life and the trauma and what is it that's leading them to coming back?
And I'm sure the foods that we have, here in America don't aid to that either.
Well, no, and everything is good, and I am a foodie. Everything's sweet, salty, and fatty, and that's a trifecta of like why everyone loves to go and eat. And I really of the mantra that it's not that you're never going to have pizza again. That's what I tell people. Because I really do favor low carbohydrate diets, keto, low carb, to lose weight in the rapid pace. But the reality is that is a harder lifestyle to maintain. I can get people to lose that weight, but how are we going to maintain it so that you're not?
And some people just need a little bit of help. Like it's not always just exercise, healthy diet. Some people just need a little, kickstart to kind of help get them where they need to be.
Right.
So one of those services that you offer that kind of helps people get to their goal a little bit easier is semaglutide.
Yeah.
Tell us more about that.
Yeah. So semaglutide, we have a lot of things that we offer here at Silhouette. I'm going to tell you in the 10 years, we really started off using appetite suppressants, which are FDA approved. They've been around since the 1950s, really work in a way that also helps in the brain. It increases neurotransmitters, norepinephrine, epinephrine, slightly increases metabolism, helps you not be hungry. They've been around forever. In addition to some other things, low carb diets, and HCG, and that's a whole other topic that we could talk about, but actually very effective. But semaglutide is the best thing that's happened. It's going to revolutionize, and it already has revolutionized. A case in point, it's literally on shortage everywhere. I think there's a couple of things that we need to talk about with regards to semaglutide. People, there's some sentiment, especially in social media, regarding like who it's for. Like, oh, those people are those heavy people that aren't diabetics are stealing it away from the diabetics, and that's just not true. There is a national shortage, but keep in mind that semaglutide has been FDA approved, starting, yes, with diabetics, type 2 diabetics in particular, but then also reached out when they saw that 15% of your weight loss over the year could be achieved by the semaglutide. They went back and they got FDA approved for being overweight. That's a BMI of 27 plus a comorbidity, meaning you have lipid changes, PCOS, hypertension, or if you just flat out have a BMI greater than 30. Showing any time of insulin resistance. What does that mean? Your body's working harder to metabolize sugar. You're having exaggerated responses of insulin. What makes it groundbreaking really is that pretty much anyone can do it. And the side effects, although, they could be exaggerated, I honestly in my practice have been pretty manageable. So let's go through. We've already said who's a candidate. And I believe that this is actually going to be expanded to anyone who's overweight. And we have to really focus on what is the maintenance plan going to be? And I think that's in the part 2 of if we ever do another podcast, is like, okay, well, what now after? Because I think losing weight is the easier part. It's but
you have to maintain your lifestyle in order to maintain your results.
But once I have someone that's on blood pressure medicine for hypertension, I don't pull them off their hypertension medicine. Now, whether we do that continuously as a maintenance or we have some type of a plan where you're on a low dose or you come in a couple months, I always tell clients, like, don't feel bad if that's what we have to do for you. Don't feel like you come back with your head down if you've regained some weight. What I would ask though is we do that at a certain threshold. Is it 5 pounds? Is it 10 pounds for you?
Right.
Even if you're working out, even if you're eating right, the holidays do happen. Stressors happen.
We're human. We have to still enjoy our life, right?
Yeah, exactly. So the main reasons why I think semaglutide is so exciting is that pretty much anyone can do it. The only people who aren't candidates are people with history of thyroid cancer or a super rare hereditary cancer of the pancreas and endocrine disorder, which that's why you come see me for a consult, so we can get into those nuanced details. But if you have that, like, that. I'm going to tell you the majority of people don't. So that opens it up for everyone else. You can be hypo or hyperthyroid. Those are when the gland in your thyroid either works too much or too little. That is not thyroid cancer, so you would still be a candidate. In addition to, I even have a client who has complete renal failure because it's not cleared by the kidneys, and she is able to do it because it's metabolized differently. But the main ways that it works and why it's so groundbreaking is that, say that you do diet and exercise for a year.
Yeah.
People can achieve about a 5% weight loss during that time. Okay, that's just diet, exercise. When you add in appetite suppressants, you're going to hit between 7 and 9% of your weight loss. So still pretty good.
Yeah.
Anything in medicine where a side effect is losing around that percentage, they're going to die. They're going to say, oh, weight loss medication.
Yeah, automatically.
Okay, automatically. So they actually had something called Kismia, and it was topiramate, which is the seizure medication, and phenermine. Yeah. So I think they saw like 8 to 10% weight loss. That medication though, I would tell people I could start you on that, but don't be on an interview because it kind of makes your brain slow down. Like you're a little bit more dingy, but they marketed because they saw some weight loss, which, you know, is
just a little delulu.
Yeah, exactly. And so, when they started with semaglutide in their trials and they started to notice a 15% weight loss, that is just unheard of in our industry.
And the people I've seen,
it's just
that's amazing. Been on it, I'm like, oh my god, in such a short amount of time,
right? It's amazing. We just posted something on our social media.
That was,
and I thought I had done lipo on her. So I do some in-house smart lipo, and I've had some clients where I've taken off a large majority of the abdominal or central weight, and we just posted a client who's lost about 50 pounds in about 3 to 4 months.
That's just amazing.
So the first way that it works is that it basically slows down the trafficking or the GI emptying of food. What does that mean? When you eat, you stay fuller for longer, which is great. Also kind of where the side effects come from that you've heard of, or maybe not heard of, but that could be that you're like kind of burping up. So even if you went and you said, I'm going to have a lettuce wrap burger, but it's kind of heavy for you, right? You might burp it up. You might get a little nauseated because it sits in your tummy for longer, right?
That makes sense.
People can have some vomiting, diarrhea. It also takes away your natural thirst reflex. So you can get constipated, but it's mostly because you kind of forget to drink water. So I say, drink around 80 ounces. Over 100 ounces is kind of overshoot because you just start to get swollen. But that's kind of like why the first reason it works. The second reason, it sensitizes you to insulin. All you hear around town, even if you're non-technical, is there's insulin resistance. What does that mean? That means that someone who has a little bit more weight around the abdomen tends to respond in an exaggerated way to the sugars or the carbohydrates they're eating, right? So that when you eat something versus someone with a weight problem eats something, they're going to have fluctuations and swings in their sugar. Well, that semaglutide kind of helps sensitize you, so it makes you have less of those swings. The third reason, which is why I think this is groundbreaking, is that, and this hormone is made in the small intestines in your body already. But this hormone goes to your brain and it tells your brain to increase factors, which are called satiety factors, hormones that make you feel not hungry. So you could do a million diets in the world. The reason why low carb is really what I pair it with, because if you eat enough fat and a moderate amount of protein and low carbs, you should be full. And then you add this medicine on and you literally are not hungry, which is amazing. Now that is once you titrate up to the proper dose, and that's what I help you with.
So are you adding appetite suppressants with it if it's already kind of making you feel like you're not hungry?
By that time, when you're not hungry, you don't need them.
Yeah.
I do add them, and some people might not agree, but this medication, you need to get to the point where you're not hungry. That means that the first entry level dose, so that you make sure that you're not having the side.
Yet.
Exactly.
Yeah,
so when I add the appetite suppressants, and I say people can get them every month until they feel that they're not hungry. So that's kind of what I do. And I think it's appropriate because the first month is pricey. The way the FDA does it, they're very conservative. So I just kind of do an accelerated version of that dosing. You trying to get you to the dose that makes you not hungry. The way that you'll know that you're not hungry, this is what I tell people, that you should basically be eating your birthday dinner and pass half to your partner. Or, just be like, I'm done. That's when you're knowing, oh my God.
I see that like when I go to lunch with friends and people that I know that are on, semaglutide, like I cleared my plate and they're like, like their food is like still
It's
like
the
it's not
most
finished. And I was like, are you gonna eat that? And they're like, oh, I'm full. And I'm like,
it's the most bizarre
there's
thing.
like, you barely touched it, you
Yeah,
know? So it's just like
exactly.
so interesting.
The most interesting part is, aside from increasing the satiety hormones and making you not feel hungry, they're also, CNN just did a story, 60 Minutes. It also is triggering a portion where it's kind of calming down the brain and the chitter chatter of like, what am I going to eat next? What are my cravings? They're seeing that it actually helps with nicotine, smoking cessation,
Wow.
alcohol abuse, even online shopping, Lena. So maybe there's a cause for you. Yeah. Where,
like,
where it's hitting a part of the brain with
Yeah.
this compulsive behavior. That is what I really think is going to make this really life changing. I think as soon as the manufacturer can make enough, as soon as it goes generic, it's just going to be all over, because really low side effects with that. Really well tolerated. Every month, the way the FDA says that you should dose it, every month you pretty much double until you get to max dosing. The way that I do it, I just safely monitor. You have my direct contact and availability to me, but I increase your dosing.
And I think it's so important for like everybody. I know there's so many different ways to get your hands on this, but I think it's really, really important to do this under a supervision of a doctor, getting your lab work done and having that monitored, because it's, you know, like she said, there's so many different, you know, it's rare, but there's a lot of things that you need to make sure you're, you know, you're not one of those people that has, you know, X, Y, and Z that's going to make you the right candidate for this. And that's really important.
Absolutely. And you'll feel better about it. And you do get the guidance, which is really nice. You know, everyone wants to feel like they're supported in some way. And I think that Silhouette makes it so that you have access to us 6 days a week. And we really do try and go above and beyond to be there for our clients.
What are some like common questions you get from your patients, like during the consult phase, or like just like myths that you've been, you know, hearing out on social media and, you know, about this that's kind of like scaring people away, that's just not true?
I think that mostly, I think it would be like, oh, I'm going to puke my brains out.
Yeah.
And really, that's why we dose you in a stepwise fashion. Oh, if I lose so much so fast, what about my skin? There's no study that shows how fast you lose the weight, one, for maintenance. So if you lose it fast, doesn't mean you're going to maintain it any worse or better versus a long and steady. And then skin integrity is really interesting. I mean, you can have someone who loses quite rapidly, and then versus slowly. I think that in the end, you still kind of have a little bit of a deflated look, just inherently, just because of your genetics, your skin texture, your background, your age,
all of
whether
that.
you lose it fast or not. I mean, that is just something that you're going to have to deal with. And that honestly, we can help you deal with here at Silhouette with our fillers and whatnot. And, you know, it just depends on how much that bothers you. I always tell people, yes, you know, those are things that absolutely can happen. I can't predict which people are going to have that or not, but it's a nice problem to have later.
Yeah.
You know, and there's surgical and non-surgical things that we can do to kind of help with skin laxity, you know, whether it's going to full correction, me sending you to a plastic surgeon, or we do some in-house procedures where we can do laser skin tightening with that. That's
totally
more minimally invasive. But then some people will say, well, you know, when I lose a certain amount of weight, I'm going to treat myself to this. And I think you should, you know.
Yeah, 100%.
And so all those are the kind of most popular things. Or will it work? You know, do you think it'll work for me? And I really haven't had a client that it didn't work for. Now, I will tell you that if you, what I have noticed in my experience of dosing this is that if you have, I'm going to throw out a number. If you're over about 200 pounds of what I've noticed, it does take you longer to feel not hungry at that weight.
Yeah.
200 above. If you have a little bit less to lose and you're a little bit less, I feel like
you feel it a little more.
You feel it a little quicker. That's why you have to be patient. It is a process. I have to get you to a steady state, meaning I have to get the medication to a certain level where it starts to work. That takes longer in someone who has a little bit more weight. Again, I'm here to guide you. Now, I do give you a diet though. I've had people on the first month lose 2 pounds, and I've had people lose 20 pounds. I'm going to tell you which ones followed the kind of low carb diet. And that's even with the low dosing on the first month, the studies show you should lose between 5 and 9 pounds. So
at least
5 and 9. Yeah. So you have to kind of, meet me halfway, of course. To kind of optimize your goals.
You just have to be committed. Like if you're willing to like get in it, it's like all or nothing. Like you got to make it, worth it.
And you're spending, you're spending some good money. And so I really do want people to feel like they're getting a good value. That means, and most people do, they see that because they're spending the money, which is very motivating.
No, I think, semaglutide is like our top seller right now. Like everybody wants it. Everyone wants to start
because it totally works. It totally works. So we have different forms of semaglutide. There's the injectable form, which is a weekly dose titrated up with our unique titration schedule. But in general, you're going to go up until we get you to max dosing, or we stop you at a dose where you feel that you're not hungry. Right now in California, we're having issues shipping compounded medications across state lines. So we've had to switch to the troches. And so there's some pluses and minuses. And I'm just like a straight shooter. I'm going to tell you that I think that for someone who has a lot more weight to lose, I feel like just from some of the feedback of switching from the injectables to the troches, and a troche is a small pill that fits in between your cheek and your teeth, or you can do it under the tongue and it kind of dissolves. It's a daily medication versus a monthly injectable. I don't think that it works as well as the injectables, and that's tough
based on their weight.
But also if you've never done the injectables, it seems like the troches actually do work a lot better because for that population. So say that you're just coming to me new and you've never tried anything else, there is an effect. I feel like we're hitting more like instead of 15% weight loss, we're probably hitting about 10 to 12%.
Yeah.
And it takes a little while longer for it to kick in. So if people just started with the orals, they actually are fine and are happy. But people switching over from the injectables to orals are not happy. It's just not the same for them. So, do I want to get back the injectables? Yes. And we're on the hunt to have a pharmacy in California, but they're just so impacted now that they're not taking new clients. So
I know it's so crazy.
It's so hard. So I'd rather people do the right thing. And if they could find a provider where they can get the injectables, and I will literally recommend that to you, because for us, we have a wide variety of services. And if you later want to come back to me with and get an appetite suppressant or do a facial or do a microneedle, that's going to come back. I think people appreciate the honesty of,
Yeah. And I think, that's what everyone loves about you is you're so honest about everything. And so that's why they feel it's a weight loss, and especially hormones too. It's such a vulnerable topic for some. Mm-hmm. It's kind of, hard to talk about those things with clients. Whereas I feel like you have mastered the art where they're just so open and they're so, just like forgiving about like, just being honest about, hey, this is what your issue is.
Right.
And, this is how we can help you, but I need, your commitment, and I need you to do X, Y, and Z, and we'll get you there. And it, it's not always easy for all clients to be open to that.
Oh, totally. Yeah. There's a lot of shed tears sometimes. Well, just because we talked about the emotional components.
Yeah. No, totally.
So I think in general, people are really having a good response to it. I'm hoping that over the next, 2 to 5 years, it just is going to be able to be more abundant and available for clients, easier access, maybe. And I mean, for us and our bottom line, this isn't a good statement, but even covered by your insurance, I just think it's like a right that everyone should have to be, skinnier,
no, of course,
healthier. Why not prevent diabetes? Why not have it covered before we need to be diabetic? It's like you have to be diabetic, get it, and then lose the weight so that's backwards thinking. As far as I'm concerned, but here we focus on a lot of wellness,
I love
whether
that.
it's, maintenance, whether it's hormones. And so, I'm really just excited to be part of the journey, into helping people, really feel a connection with them and feel like I'm doing it, trying to help
doing
people
the Lord's
with
work.
Oh my God. I'm just, I'm trying to be a partner. And so,
no, that's
if
awesome.
I could do, and this is the last thing I will say about weight loss. Physicians get a minimum amount of training. doing weight loss. Everything that I've learned has been after I graduated, doing specific courses, training, learning about diets. I've had people who've lost 50 pounds with me, went to their doc, and their doc derailed them saying, oh, just drink less beer. I literally had someone, my brother-in-law, that he lost 50 pounds. He went to his primary, told him how he was doing it. He said, why don't you just stop drinking beer during the week and you'll lose? I mean, it's just such backwards advice. Like, I'll have someone on a low carb diet, which they don't even know what that means. They'll say, no, you need to eat vegetarian and eat all carbs. Like, I am all about plant-based. I hear you. I do think we need to eat as much veggies as possible, but it's just physicians really do not. To make blank statements to people like calories in, calories out, to make blank statements on, oh, you don't know what you're doing. It really does have an impact on the patients and on you and your psyche. So what I tell people is like, you have to decide, are you going to come to someone who's a specialist where I know what and I'm not trying to be stuck up, but I'm just going to be like upfront. Like, I know what I'm talking about. Or are you just going to take some offhanded, comment by your primary who spends 2 seconds with you and doesn't even explain to tell you you're fat, you have to lose weight. They don't even tell you how. And I have a real issue with that. So
she's a real one.
Yeah, pick. You're going to come to me. I will help you, but you have to really then buy into what I'm telling you. And I have a lot of different ways to come at it. It doesn't have to be purely keto. It doesn't have to be low carb. We could do a variation of that. And I still believe you should eat as many veggies that grow above the ground with as many good fats as you can, and then add some protein.
You're the expert. Thank you so much, Dr. Esteva. Thank you for being here.
Thanks for having me.
I don't want to hold you back from your amazing patients who need you right now.
Oh, so do I have to go?
All right. You do have to go.
I'm just so excited. It's like NPR at the end. Like,
right?
I was like, if I'm ever on NPR, what am I going to say? Thank you for having me. It's been a pleasure.
It's always a pleasure. Well, thank you so much. And that's, it for our podcast episode today.
Yeah. What am I supposed to do? See, old people, we don't know what this means.
Bye, guys.
Ciao.